Hello and welcome to today's episode number 2020 of the Human Condition Podcast. I'm your host, American Council on Exercise Certified Personal Trainer, Kerry Jones. This is an unscheduled episode, and it is an off-schedule episode because I felt that this topic was so important for me to cover from a personal standpoint and a health coach standpoint that I wanted to make sure that it became evergreen content, like a searchable podcast or something that you could find and listen to whenever you wanted. Now, bear with me because this is going to be slightly different than usual, only because I'm going to be directly reading from research articles that I found online and commenting on it. So if you're watching the video version of this podcast, you're going to see it pop up a lot, only just because I want people to be able to see it. The first thing is, let's talk about the article that I heard on NPR this morning. It was, "Doctors find fresh evidence that fruits and veggies can act as powerful medicine." And the summary of this episode is, "A spate of food is medicine studies point to benefits of prescribing healthy food to people at risk of metabolic and diet-related diseases. A JAMA internal medicine study found an RX food program led to lower blood pressure in patients, which over the long term can reduce the risk of heart attacks and strokes." Now, in the past, I have mentioned on the podcast that food, diet, nutrition can be used to either combat existing conditions or help prevent conditions from forming in the body. And so I didn't know that. I knew that they were doing like food as medicine type research, but what I didn't know was that there were RX programs that existed. And what it led me to do was come home and really look into it because I was curious about what that could mean for people. And so I had found this National Produce Prescription Collaborative, Improving Health by Embedding Produce Prescriptions, PRX, into healthcare practice. NPPC works to curb the equitable and national burden of diet-related diseases and integrating produce prescriptions as prevention and treatment for diet-related diseases into standard clinical practice through policy at the federal and state level. Now, that was something that really caught my attention, and I was very, very curious about this. I have yet to look into where this program exists, what states it exists in, and how far embedded it has gotten itself into the federal policy. Part of what I want to do for the near future of the human condition is to build a network of healthcare professionals in order to eventually apply for my NPI number and make sure that my services are able to be billed to insurance. I do not know what all of that entails yet. If you're listening to this and you know, if you're one of those people that's just smart like that, please feel free to let me know, because I feel like this is a huge key thing. I feel like, never mind. The idea I was about to say is going to come up in a minute. So I found this Produce Prescription Collaborative, and it got me thinking, why is this not something that we do more of? And I also wanted to know what the research was behind it, because this NPR article also briefly mentioned something about the psychological benefits of doctors prescribing physical activity. So what this got me interested in doing is looking into the benefits, research surrounding the benefits of prescribing exercise. And so I use Google Scholar for this, specifically for this today, because what I didn't want to do was find sponsored studies. I wanted to find things. I mean, there's obviously sponsored studies on here, but you're going to find less of the paid to be at the top of the list type things when you use Google Scholar. Anyway, so my first search was benefits of prescribing exercise. And what I'm finding is things like this. Here's the British Journal of General Practice, exercise prescription. What does it mean for primary care? Now I'm going to read this part, and I'm going to also have dialogue simultaneously. So it helps if you're looking to find where I'm talking and where I'm not reading. So the first part of this is, how far has exercise prescription progressed? Goodness. Hopefully I don't read like that for the rest of the time. It says, exercise promotion is not a new concept. The ancient Greeks were among the first to promote exercise, with Hippocrates himself stating, if we could give every individual the right amount of nourishment and exercise, not too little and not too much, we would have found the safest way to health. Little progress was made from then until the 1800s, when a physician named Mackenzie was one of the first to think of exercise as a medical treatment for chronic disease rather than an activity reserved for the physically fit. I have heard it said before, and I'm sure you have too, history repeats itself. And I have also heard there are no new ideas under the sun. I feel like that is applicable here because this was all the way back during Hippocrates' time when he determined that physical activity and nutrition were key to preventing certain conditions. I don't know specifically what it was that he was looking at the time. That's not the point. The point is, the idea has existed forever that proper nutrition and physical activity are key to a healthy lifestyle. The fact that little progress was made until the 1800s, I mean, there is something to be said about the non-interconnected way that society was back then on a global scale. But we'll skip over that part right up until the exercise as a medical treatment for chronic disease rather than an activity reserved for the physically fit. Here is where I'm saying that no new ideas exist under the sun. At a point in time, it was thought that physical activity should be reserved for physically fit people, like athletes. We are entering a period in social media where we are deeming certain physical activities as being exclusive to the people that look like they should be doing them. I have mentioned this before, but it bears to mention again, especially in this context. I think that is exacerbating this issue where we have this preconceived notion of who should be able to engage in certain types of physical activity. But anyway, to continue on with the article, and I apologize if you're watching this, my transitions are not super clean because this is the first time I've ever done this. But in the UK, there have been many attempts to get the country more physically active with a host of strategies and initiatives. The government has tried to sell exercise as a low-cost, low-tech, and non-drug intervention to improve the health and social welfare of the population. But how far has exercise prescription really come? And why has exercise awareness and promotion not progressed as far as other public health concerns such as smoking, diet, and alcohol? I'm going to tell you why. This is my belief, but it's also very hard to convince me otherwise. This isn't something that like everybody assumes, but it is this. There is nothing financially lucrative about promoting eating better and physical activity. You cannot get rich by telling somebody to exercise and eat more broccoli. And that is so unfortunate, but it's about money. Follow the money. There's no pharmaceutical company that is going to pay you to promote healthy physical activity. Most of these things, most of these conditions, metabolic, chronic disease, whatever, lifestyle issues are treated acutely by pharmaceuticals. The more times people go to the doctor and the more pills that can be prescribed to these people, the more money the healthcare industry can make. And I really hate to say that, and I know it makes me sound like a Debbie Downer. I feel the exact same way about the health and wellness industry, though. Any industry that should be in existence to help people, but would rather generate a profit, I am going to not look upon lightly. So the only thing I'm going to be reading on these articles is the introductions and or abstracts of these things so that we're not sitting on here too long. But anyway, just to continue, I'm going to read this whole paragraph. The World Health Organization has reported that physical inactivity is one of the 10 leading causes of death in developed countries and results in about 1.9 million preventable deaths worldwide annually. The benefits of physical activity on various health issues, including atherosclerotic vascular disease, hypertension, diabetes mellitus, which is just diabetes, osteoporosis, dyslipidemia, obesity, mental health, and a reduction in mortality are now undisputed. In addition, a sedentary lifestyle is shown to be a more significant risk factor for coronary artery disease than other established risk factors such as smoking, hypertension, and hyperlipidemia. There are also positive economic benefits of physical activity programs to communities, corporations, and public health, shown by cost-benefit ratios. Less openly known and discussed benefits of exercise include prevention against certain cancers, with studies demonstrating that physical inactivity can almost double the risk of developing colon cancer, with other cancers such as breast, prostate, lung followed close behind. So that was the first article that I looked up, and it's a UK-based article. I had a hard time finding any US-based articles within the last few years related to this topic. And just so that we understand that this is an existing problem, the first article that I read came out in 2014. So I tried my best to, some of them I reached back on a couple years just because I wanted to show that this is an ongoing and consistent issue. But then I also pulled recent articles, 2023, 2024, 2025, to show that it is still a problem, and it shouldn't be. So let's move on to the next article, and we'll start by reading the introduction. Prescribing exercise and physical activity to treat and manage mental health conditions. This is from the UMJ Ulster Medical Society. Again, not a US-based thing. So, the significant health benefits of physical activity, which include exercise, have long been recognized, as well as reducing non-communicable diseases, NCDs, such as heart disease, diabetes, and specific cancers. Regular physical activity leads to improvements in mental health and cognitive function. Shockingly, around 5 million deaths per year are attributed to physical inactivity. Within the UK, this accounts for 1 in 6 deaths, which is on par with smoking. Of equal importance, it is estimated that 40% of long-term conditions could be prevented if the population successfully met the UK Chief Medical Officer's physical activity recommendations. Furthermore, once a chronic illness is diagnosed, treatment is better managed with physical activity as part of the disease medical management plan, leading to the idea that exercise is medicine and should be part of every treatment plan. Indeed, there is objective evidence that exercise can be used as an effective first-line treatment for an array of cardiovascular, metabolic, musculoskeletal, psychiatric, and neurological conditions. Another research paper that came out about the benefits of physical activity. And again, another research paper. This was 9 years after the first one that I read, that indicates that physical activity could be used as a preventative measure for a lot of lifestyle-related diseases and illnesses. The fact that these articles are 9 years apart, the fact that Hippocrates said what he said when he said it, which was hundreds and hundreds and hundreds of years ago, why are we not at a point now where this is common knowledge? I was shocked by this article that I had found. Let me make sure that I pull up the right article first. Here it is. This is part of the problem. This is a huge part of the problem that I didn't even know existed until I found this article. So, we'll go back to this. This was not from the NIH website. It was just an article that I found. Again, it's through Google Scholar, so whatever. The title of it is Healthcare Practitioners' Perceptions of the Barriers to Prescribing or Promoting Exercise in the Treatment of People with Mental Illness, a Scoping Review. In short, they're just interviewing primary care doctors about why they think that there are barriers to prescribing physical activity to their patients. Here's the abstract. Contemporary healthcare for those experiencing mental illness requires healthcare practitioners to effectively incorporate the prescription of exercise in their treatment in accordance with clinical guidelines. However, there has been a lack of effective implementation of such recommendations. Not even in just with mental health. This is across the board. The purpose of this review was to identify barriers to exercise prescription in the treatment of people diagnosed with mental illness as perceived by healthcare providers. APA PsycInfo, CINAHL, Medline, and PubMed electronic databases were searched for relevant articles published in the period from January 2005 to September 2023. A total of 18 papers were included for thematic synthesis. 4 key themes were identified across the qualitative, quantitative, and mixed method papers. When I first read up until that point, I had already made a snap judgment of what I thought it was going to say. And my snap judgment was this. What ends up happening whenever you're trying to make sweeping recommendations to society across the board, there is this bias for some reason to soften the blow or to just recommend what you think people will do rather than just give them the facts and let them decide that for themselves. And I have heard that said and read it in a book called How Not to Die. Not my most favorite book, but definitely that part definitely makes sense. So my initial thought was that doctors weren't prescribing physical activity because either they assumed that their patients weren't going to do it, or that there was going to be something that prevented them from prescribing the correct type of exercise. And I was incorrect in my assumptions. So these are the 4 key themes that were identified across all 18 of these papers. Lack of knowledge and confidence of healthcare providers in prescribing exercise, role and responsibility, healthcare providers' misconception of client barriers, and systemic issues impacting exercise prescription practices. A lack of knowledge and confidence was the most common barrier. Some healthcare providers indicated a desire to develop their skills in exercise prescription, while others indicated a preference for an exercise professional to take responsibility for the aspect of treatment. Systemic barriers were spread across a range of issues, with lack of time, excessive workload, and difficulties accessing qualified staff most commonly cited. The review provides further insight into the barriers to exercise prescription faced by healthcare providers and makes recommendations regarding how to address these barriers in order to better implement clinical guidelines and thus improve the quality of treatment provided to people diagnosed with a mental illness. Again, this is not even specifically just about mental illness. This could apply across the board to so many different things that are caused by lifestyle choices. Type 2 diabetes, other metabolic conditions, obesity, certain types of heart disease. There's a lot of things that are preventable, and they would be preventable if we could just educate people and make them care about their own health and wellness. But I was not anticipating the fact that there were doctors, and I would have to go and find these individual 18 papers to know exactly the pool and methods, the pool of doctors that they interviewed and the methods that they interviewed with. But I was not anticipating that doctors lacked the confidence to be able to appropriately prescribe these things. And so this begs the question why we have yet to incorporate health and fitness professionals into the healthcare continuum. This is not a new problem. And I have said before, we are in a period of time where we have the most access to healthcare and mental health and health and wellness related information that we have ever had previously. Yet for some reason, we are the sickest that we have ever been, mental health or physical health related. There are some promising things that are occurring to show the slowing of certain major diseases and chronic illnesses that have been impacting our society for years. But given how long we have known and have had this knowledge, there is no reason that we should be where we're at. So I looked into, the next thing I did was search produce prescription in Google Scholar. And again, we'll react. These ones I skimmed more so than the other ones, so you might get some genuine actual first-time reactions from me from reading this, but this is Impact of Produce Prescriptions on Diet, Food Security, and Cardiometabolic Health Outcomes, a multi-site evaluation of 9 produce prescription programs in the United States. Did you know that there was 9 produce prescription programs? Because I didn't. Abstract background. Produce prescriptions may improve cardiometabolic health by increasing fruit and vegetable consumption and food insecurity, yet impacts on clinical outcomes and health status have not been evaluated in large multi-site evaluations. The conclusions of this particular version of the study was, in this large multi-site evaluation, produce prescriptions were associated with significant improvements in fruit and vegetable intake, food security, and health status for adults and children, and clinically relevant improvements in glycated hemoglobin, blood pressure, and BMI for adults with poor cardiometabolic health. That was the first one, and that is just a glimpse. And I know I have said before to be very cautious about what it is that you're reading in terms of studies, because causation does not necessarily mean correlation and vice versa. Sometimes you could be drawing the wrong conclusion from certain things. Sometimes these studies are sponsored and they are biased. Whatever the case is, if you are knowledgeable at all or pay attention enough, you know that these are common issues across the board. These lifestyle conditions, these increases in things like cardiovascular disease and metabolic conditions, these are happening to people in younger and younger ages. And so the fact that the knowledge exists and we are not using it has caused me to look into this and create this podcast, but it also absolutely verifies my desire in creating the human condition. My methodology, my belief system, my morality as a health coach, all of these things play into that. And so we'll look at one more research document that I pulled up just because it helps to have more than one. So this is Food is Medicine, Strategies for Nutrition Security and Cardiometabolic Equity. The abstract of this: Food is Medicine, FIM, I don't know why we have to make an acronym out of everything, represents a spectrum of food-based interventions integrated into healthcare for patients with specific health conditions and often social needs. Programs include medically tailored meals, groceries, and produce prescriptions with varying levels of nutrition and culinary education. I want to point out that very specific part, that line, the fact that things have to be individually tailored is key enough for me to focus on, because that just goes to show you that everything needs to be on an individual level. You cannot make generalized meal plans and expect everybody to live in an optimal healthy lifestyle based on something that works for the few and not for the many. Anyway, supportive advances include expanded care pathways and payment models, e-screening for food and nutrition security, and curricular and accreditation requirements for medical nutrition education. Evidence supports positive effects of FIM, food as medicine, on food insecurity, diet quality, glucose control, hypertension, body weight, disease self-management, self-perceived physical and mental health, and cost-effectiveness or cost savings. However, most studies to date are quasi-experimental or pre/post interventions. Larger randomized trials are ongoing. New national and local program and policies are rapidly accelerating food as medicine within healthcare. Remaining research gaps require rigorous, iterative evaluation. Successful incorporations of food as medicine into healthcare will require multi-party partnerships to assess, optimize, and scale these promising treatments to advance health and health equity. The fact that multiple articles exist across decades, and we are still in this period of having to research this to prove the point that we have already proven time and time again. If this were a prescription drug, this would somehow have already reached the market by now. And if it were a prescription drug, I would have felt more comfortable that we were still in this research and testing phase. But when it comes to food as medicine or prescribing physical activity, there is no harm. Only good can be done in increasing the initiatives to bring this into the healthcare space and to incorporate health and wellness professionals into this and to just do it. There is only good that can come from it. The only thing that you can do is improve people's health. There are obviously nuances to it, like focusing on allergies and engaging in physical activity that is not going to hurt somebody worse. Like some people with heart conditions should not be doing excessive cardio, for example. There is no reason why we should not have further advances on these two areas. It is mind-boggling to me that we are here. And I'm feeling really fired up about it today, if you couldn't tell, which is why I had to make this episode. And the hope is that I can communicate effectively in such a way where people will take this idea, they will take what I'm saying, they might do their own cursory research, they might want to incorporate these things into the types of, like when you care about, your friends and family, you always say things like drive safe or whatever. I always tell my dad to make sure he's sleeping more, whatever the case is. Incorporate this type of knowledge into your day-to-day so that we can slowly but surely have an impact on these preventable and treatable conditions. It costs people so much money, either from having to go to the doctor or be prescribed medications or undergo certain procedures for something that could have been prevented. And this needs to go all the way back to when you were in school. I remember, like, when I was in middle school, we had shop class, we had home ec class, we had health class, but most people, the only thing that people remember about health class is like learning about STDs and watching that really old video about a baby being born. And I don't even know if they still do that. Regardless, these are the types of things that we need to be teaching kids in health class. They need to know this stuff early, because when you get to my age, in my mid-30s, there has already been damage done. I have already been on the path to certain metabolic conditions or chronic illnesses or whatever the case is, unknowingly. And so, the future of the human condition is going to remain in exactly the direction that it is pointed in. I want my NPI number so that I can be billed to insurance. I want to ingratiate myself into the local healthcare. I want to create the scaffolding that can be repeated from county to county or from state to state so that health and wellness, health and fitness professionals can be involved in the healthcare continuum, so that doctors don't feel like they have so much on their plates, so that their patients can go see somebody and become like deeper educated on lifestyle choices, so that they can manage or prevent things that they might be on track to get. So that was this random podcast episode. Let me know if you liked it. It was kind of off the cuff. There really wasn't a whole lot of forethought that went into this episode, but usually when I am passionate about something, there doesn't need to be a lot of forethought. I can just talk about it. That's kind of what happened in episode 19 too. Like I knew what I was going to talk about, but whatever the case is. If you liked what you heard, if you want to know more about it, if you're interested in seeing me across the social platforms, if you want to read my blogs, if you want to see what I do on a day-to-day basis, I do a lot of that on TikTok. I go live on TikTok a lot too, if you ever want to catch me like live and in person. If you're interested in the education as it applies to your own personal life, visit my website, fill out a contact form, or send me an email for a free consultation. Whatever the case is, leave me comments, write me emails. I love when I go live and people will ask me questions that I can answer in real time. I volunteer my time to go live because I know that health coaches are not necessarily accessible to everybody, whether it is cost prohibitive, time prohibitive, whatever the case is. So I volunteer my time when I can to be available to answer questions. But anyway, before I get way off on another tangent, that is today's podcast episode. I really hope you enjoyed it. And I really hope that the way that I'm going to have to edit this works out. So yeah, until next time.